I want to know from you. So, what do you thinking about your understanding for last 3 classes about insulin, insulin resistance, right? Metabolic syndromes. This is very important for your exam. What are the other names of metabolic syndrome? Anyone? What are the other names? Well, yes? No, not at all. So this is a conceptual problem is there. Pre-diabetic does not mean at all is a metabolic syndrome. Metabolic syndrome happens after the insulin resistance, established insulin resistance. A pre-diabetic happens when? Into the insulin resistance period occurring. ঠিক আছে? যেমন আমার ক্ষেত্রে এখন হয়তো pre-diabetic ফেজে আমি আছি। Insulin resistance is going on. তো যদি ব্যালেন্সে আমার আছে গ্লুকোজ বাড়ছে ইনসুলিনও বাড়ছে ইটস ওকে সো ইফ ইউ টেস্ট দ্য নাও অ্যাট দিস লেভেল যে আমি দেখি আমার ডায়াবেটিস হয়েছে কিনা whether diabetes present or not, glucose level is normal because you are increasing glucose and also insulin also increasing to maintain the glucose level. Suddenly what will happen, it starts insulin resistance, right? Then again what will happen, insulin will be like that and then it will go up and up. It will also go up little bit, but this imbalance is there. So now if you go for the test, that will detect that hyperglycemia is present and diabetes type 2 or type 1 will be there. So that takes long time. So in these cases pre-diabetics can happen. So pre-diabetics does not mean or does not at all that is your metabolic syndrome. Metabolic syndromes, other names can be given, can be asked in exam. That one is syndrome X, another is insulin resistance syndrome. One is syndrome X, and another is insulin resistance syndrome. Insulin resistance syndrome, right? And also metabolic syndrome itself. So, who can say the metabolic points, metabolic syndrome 5 points? কে বলতে পারবে? বলো। 40 inches কিন্তু হ্যাঁ? Inches. হ্যাঁ? না সেন্টিমিটার নয়, inches. 3 high, a 4 high, 1 low. HDL low. Huh? No, that is not the criteria, right? So 4 criteria are why increase. Sit down. One is waist circumference, blood pressure, blood sugar, and triglyceride, and less is HDL. Simple. So metabolic syndrome is actually happens when we are accumulating more and more fats and subcutaneous fat saturated done, visceral fat or ectopic fats accumulation occurring and started, and then only we have crossed our personal fat threshold, then only it's landed into the, first it will landed into the obesity. First we will land into the obesity. So what does it mean of obesity? Obesity is also in your syllabus. Obesity, consequences of obesity, pathophysiology of obesity, it is in your syllabus. So what do you mean by obesity, anyone? What does it mean? I can explain that how obesity can be landed into the metabolic syndrome. And that is the only conceptual class is there, the how you can land into the metabolic syndrome through the obesity. Because if you remember, one of the important cause of the insulin resistance was obesity, obese, lifestyle changes, and other causes like stress, like hyperinsulinemia, right? There is a gross sleep problem, there is a gross low body mass or muscle mass. These things are very much important to creating or establishing the insulin resistance. Why we are nowadays is focusing so much about the insulin resistance? Because most of the cases or most of the chronic diseases are related to the insulin resistance. So nowadays, insulin resistance does not mean only the diabetes mellitus, etc., etc. Because you have to keep in mind that I already told you that glucose homeostasis means insulin. It does not nowadays. It does not mean that, because glucose homeostasis করার জন্য আরো others hormone help করে. But we already 11, 12, 9, 10 already we have been taught that insulin is our important for the glucose metabolism or glucose. No, not at all. It can be say that famous. Insulin is famous for glucose metabolism or glucose homeostasis on our body. You can like that word, that it is a famous but not important, right? So that when you are dealing with any types of diseases, I already told you that lower grade inflammation is one of the important, chronic inflammation is one of the important cause of the resistance of insulin. Insulin is at the your receptor level. When you are establishing the insulin resistance, does not mean it will be landed into diabetes mellitus. No, insulin resistance go for the 10 to 20 years to 15 years. Then only when exhausted beta cells and as well as visceral fat accumulation will be there and low grade inflammation will be there, stress is there, then what will happen? Beta cell stops to release the same amount of insulin to cause the glucose transport into the cell, mainly the GLUT4. You already know that insulin has some action for the translocation of the intercellular GLUT4 into the cell membrane so that glucose can enter. Because glucose is toxic for our blood vessel. Glucose level must be reduced so that it can damage the endothelial cell and other toxic problems will be there. So GLUT4, you already know that how the glucose transporter happens here. That is a PI3K AKT pathway, right? That is two pathways already described. One is for our your cellular metabolism. Another is for growth, proliferation, survival, or you can say differentiation, that is MAP kinase. You already know that insulin resistance hampers only the PI3K and AKT pathway, not the MAP kinase pathway, right? So insulin resistance is keeping free of that MAP kinase pathway to cause different cancer, growth, mass, etc. So that is also related. Nowadays, so much cancer are there. All are written in good books and journal. One of the important and number one cause is insulin resistance. So insulin resistance already you all in the phase of insulin resistance to some extent, because some of boys or maybe girls is now already started to take drinkings, alcohol and also smoking. So it will not understand that whenever he is 30 age, 40 age, then you can understand what is happening, and that is irreversible. But when you are insulin resistance, you are understanding that yes, I am insulin resistant, lifestyle changes, food habits, physical activity and also stress-free life may reverse the insulin resistance in backward into further sensitivity. Not only that, this term is that the obesity nowadays one of the important cause for the metabolic syndrome, which is related to the insulin resistance also, right? So what does it mean of obesity? Anyone? Obesity bolte amra ki bujhi? Obesity nowadays, in your book probably it is written that as a BMI, right? That is basal metabolic index. Some range is there, formula is there, kg in weight by meter, height in meter square, right? This is the BMI, simple. But if you understand the proper way, the BMI is your body mass. তাহলে যদি কোনো চেহারাওয়ালা লোক থাকে তার তো BMI বেশি হবে, তাহলে কি সে obese? Not like that. Obesity definition is now very clear cut. When your calorie intake is more than the calorie expenditure, right? Calorie intake it more than your calorie expenditure. Simple. যখন ক্যালোরি আমরা খাচ্ছি সেটা এক্সপেন্ডিচার ঠিকঠাক হচ্ছে না, that is the causing the obesity day by day. Now if you consider the BMI in the non-Asian countries, that is more than 30 BMI is 30 or equal to consider as a obesity. But in Asian country, it is 25. More than 25 is obesity, right? So 18.5, less than 18.5 is underweight, and more than 25 for Asian and more than 30 for all other countries is your BMI is called obesity. There is a term is a morbid obesity. There is a comorbidity along with this. The comorbidity and overweight, your obesity, morbidity is directly related to the metabolic syndrome. You already know that what does the 5 components of the metabolic syndrome, but believe me, all the 5 does not mean the metabolic syndrome. Only 3 of the 5, if present, then we can diagnose as a metabolic syndrome. 3 within the 5. 5 is the criteria. 5 are within the clusters of the symptoms are there, clusters of the consequences are there. But if 3 of them, that is, suppose one person having blood BP is high, glucose is high, and HDL is low, that is also a suspected case of what? Metabolic syndrome. If someone has glucose is high, triglyceride level is high, waist circumference is high, that is also is suspected case of or metabolic syndrome. You can diagnose that. So that's much important, that calorie intake is more than the calorie expenditure. এটা আমাদের মনে রাখতে হবে. That's very important. And you already know that fat burning, fuel, right? Fuel for burning is 2 mainly. There is a glucose and one is fat. So when insulin is high, then glucose burning happens. If insulin is low, then fat burning happens. So during the insulin resistance period, ultimately it will cause the destruction of the beta cells by autoimmune destruction as well as fat deposition, right? Fat deposition in pancreas itself, fat deposition over the islets of Langerhans, including the alpha cell also. So alpha cell releases what? Glucagon. And glucagon is inhibited by insulin. Now see what is happening here. Insulin inhibits the glucagon, but glucagon does not inhibit the insulin. Now, over your alpha cell, it is a fat, right? Fat deposition is there. Now it is your beta cell is releasing the insulin, right? Now insulin is resistant. Now fat is there. Do you expect that inhibitory will work? No. So that's why it will continuously, glucagon will be released. And glucagon, what does it mean? It increases when glucose is gone, then only glucose is come. A glucagon has entered. But it is inhibited by insulin, but when ectopic fat around this alpha cell, it will not work. Cannot inhibit the alpha cell by tui thumb. Amake glucose komate de. No, that glucagon will release continuously uninhibited. Show that this glucagon will try to increase glucose. Simple. Again, glucose is increasing. That means body will work to induce the insulin release. আবার বের করছে ইনসুলিন তাকে কমাবার জন্য, কারণ কি না, গ্লুকোজ is very toxic. So what is the vicious cycle is going on and establishing the insulin resistance in day by day, right? So whenever your obesity is there, there is continuous low grade inflammation already there. Already I have discussed everything, because already you know that fat globules ki hoy age hyperplasia, then hypertrophy. When it is hypertrophy, then it goes beyond the blood vessels. When it goes to blood vessel, then it lack of blood vessel supply, and that causing the death of the cell, the fat cells. And there is a foreign body, macrophages will come, monocyte and macrophage, inflammations, right? Not only that, it causes the macrophages or cytokines, some release the cytokines. These cytokines are responsible for those fat cells are going outward or away from the blood vessel. Angiogenesis happens. The নতুন ব্লাড ভেসেল তৈরি করতে সেই সাইটোকাইন গুলো আবার হেল্প করে। সো সাইটোকাইন একটা রোল হচ্ছে নতুন ব্লাড ভেসেল তৈরি করা নিয়ার বাই the old cells of fat. Fat goblets যত বড় হবে তত আমাদের বিপদ বাড়বে। মানে হাইপারপ্লাসিয়া পর্যন্ত ওকে, বাট when you are in hypertrophy phase, then your saturation will be reaching fast of the subcutaneous fat, and then only it deposit into your visceral fat or visceral sites or ectopic sites. That's the important point. So beta cells stops to inhibitions come from the insulin, and glucagon will rise, and glucagon is increasing the glucose level. Insulin will be released, and so increasing will be released, but insulin receptor will not work, right? Insulin receptor কেন work করে না? তার একটা ব্যাখ্যা আছে, বাট নট সায়েন্টিফিক্যালি অ্যাকসেপ্টেড টু মাচ। কেউ কেউ বলে না এইসব কিছু নয়, কারণ এনি রিসেপ্টার ইজ কন্টিনিউয়াসলি use. Some of the scientists says that the insulin receptors causing the endocytosis, মানে এই যে ব্লাডস, এই যে আমার সেল মেমব্রেন আছে, এখানে তো আমার ইনসুলিন রিসেপ্টর ছিল, হ্যাঁ, এইখানে আমার এইভাবে ইনসুলিন রিসেপ্টর ছিল, এইখানে তো আমার টাইরোসিন কাইনেজ, রাইট? সে কি করবে বলছে যেটা, যে বারবার ইউজ করার জন্য ইউজ অফ ইনসুলিন বাই দিস রিসেপ্টর, ইট ইজ কজিং দ্য এন্ডোসাইটোসিস। এরা কি হবে না, একটা ভেসিকেলের মধ্যে রয়ে আসবে, বোঝা গেল? এটাকে এইখানে নিয়ে চলে আসবে, দ্যাট ইজ কল এন্ডোসাইটোসিস। এক্সোসাইটোসিস মানে বের করা, ইট ইজ কল রিসেপ্টর endocytosis. It can be, it's very common for your general traumas, general physiology, that what do you mean by receptor endocytosis. So receptor endocytosis is one of the cause of the your insulin resistance, but the insulin receptor does not work when the insulin is sufficient. Insulin আছে বেশি কিন্তু কাজ করতে পারছে না, তাহলে ইনসুলিন আমার ডায়াবেটিস যে এস্টাবলিশ হয়ে গেল, ডু ইউ থিঙ্ক দ্যাট ইনসুলিন লেভেল কমতে থাকলো? নো, not at all. There is hyperinsulinemia. Already I told you that range of the phases are hyperglycemia, hyperinsulinemia, insulin resistance, metabolic syndrome, and other chronic and cancer diseases. Clear? এটাই হচ্ছে সিকোয়েন্স: hyperglycemia, hyperinsulinemia, insulin resistance, metabolic syndrome, and other chronic diseases after the metabolic syndrome established. So metabolic syndrome means 3 of the 5 is your metabolic syndrome, right? Or you can say syndrome X, or you can say insulin resistance syndrome. So calorie intake and expenditure when more, then only obesity happens, right? Now obesity means what? Accumulation of fats, adipose fat. 2 types of adipose fat are in our body. Kiki? White fat and brown fat. Brown fat is basically in the children, little bit newborn. Thermogenesis happens there, right? But your white fat is, most of the cases, is fat accumulation in the adult as well as in newborn also there. But this is a white fat we are concerned about, subcutaneous as well as your visceral fat. Now, your distribution of the fat, insulin helps for the distribution of your fat. For male, it is truncal and abdomen, and for female, that is not truncal, that is thigh, buttocks, and your belly, that is your abdomen. This is the distribution sites in case of female. So there is a fat deposition is going on, and fat deposition is going on why? Because of the insulin resistance. আমি যদি গ্লুকোজটা সেলের ভিতর ঢুকতে না পারি, তাহলে আমার লিভারের ভিতর কি কি হবে? আমি অলরেডি আই টোল্ড ইউ, ইন দ্য লিভার 1 কাপ, 2 কাপ, 3 কাপ, আগের দিন পড়েছিলাম। 1 কাপ সুগার খেলে কি হবে, 2 কাপ, 2nd কাপ খেলে কি হবে, 3rd কাপ খেলে কি হবে? So when your energy is right, glycogen storage is right, but you are putting glucose and glucose, that glucose is converted into fat, right? Inside that. But fatty liver or fat formation in the liver is 2 different thing is there. আমি লিভারের ভিতরে ফ্যাট ফর্মেশন হচ্ছে, মানে VLDL তৈরি হচ্ছে, ইট ইজ a secondary cause of fatty liver, but primary cause of formation or introduction of the fatty liver is the fatty acid distribution by the adipose tissue overload হয়ে গেছে, ফ্যাটি টিস্যু পারছে না। আগের দিনটা ছবি দেখেছি, ব্লাডের মধ্যে কি আসছে, ফ্রি ফ্যাটি অ্যাসিড আসছে, সেটা ওখানে গিয়ে অ্যাবজর্ব হচ্ছে। When it is saturated, then that will be released into the blood again, and that will come into the liver, cause the fatty liver. So in the liver, 3 sequences will be happens. One is fatty liver deposition, that is called non-alcoholic. There is not like alcohol is there. Non-alcoholic steatosis, non-alcoholic steatosis, right? And another inflammation is going on. If fatty liver is fatty deposition is going on, chronic inflammation in the liver happens. That is called steatohepatitis. That is called non-alcoholic steatohepatitis. That is very important term. It will be understand in the 3rd year onwards, when your medicine class will go on. Non-alcoholic steatohepatitis, NAS, is very common term, right? Then it will be transformed প্রথমে কি ছিল? ফ্যাটি লিভার, রাইট? তারপরেতে কি হয়েছিল? নন অ্যালকোহলিক স্টিয়াসোসিস, স্টিয়াটোহেপাটাইটিস, তারপরে কি হবে? সিরোসিস, রাইট? তারপরেতে সিরোসিসের সিমটমস অ্যান্ড সিএ, দ্যাট ইজ হেপাটোসেলুলার carcinoma will be there. Sorry. So in this fashion, this is your liver damage happening by your fatty deposition into the liver. This is a bad thing. So how can you detect the your fatty liver is there or not? By doing key, not USG. That is called fibroscan. Fibroscan is the only equipment nowadays is available, widely available, to detect which stage of fatty liver is this. The staging is 1, 2, 3, 4. Fatty liver 3, 4 is irreversible. So be very careful. It should be careful, especially those are smoking or alcohol drinking nowadays. And often it is if it is occasional, monthly 1 or 2, it's no harmful for your body. But if it is now habituated to drinking, because alcohol means ethanol, right? Ethanol itself directly damages the two sides. One is insulin receptor itself, and another is insulin receptor substrate 1. You already know that what is the role of insulin receptor substrate 1? Dancing floor? কি বলেছিলাম? Tyrosine kinase happening the autophosphorylation. Then it comes in contact with the insulin receptor substrate. That is also phosphorylated, and then come to the phosphatidylinositol 3 kinase phosphorylations, then PEEP2 phosphorylation, PEEP3, and then PKB, that is protein kinase B, and AKT pathway establish an active form of phosphorylated form, and that gives all the glycolysis, glycogen synthesis, and also many things, and glucose transportation, blood-food transportation is there. Liver cell only the insulin independent glucose entry will be there, but after the entry of the glucose, other pathways must be enhanced by the AKT PPI-KB pathway, right? So these things are happening when your fibroscan is helpful for detect your which level you are in fibrosis. So why it is important to that? That is the adipose tissue accumulation fat. So whenever you are accumulating fat in the adipose tissue, now adipose tissue is one of the important tissues there which releases lots of hormones. Some hormones are important for us, some hormones are harmful for us. Each and every day we are releasing that hormones. Anyone can say 1 to 2 hormones? Bolo? Really no. So now you know that obesity means your calorie intake is more than calorie expenditure. Simple. Now your adipose tissue are there. These are adipose tissue, hugely burdened, and then releases hormones. A group of hormones called adipokines. Short note aste pare. Adipokines. Within these adipokines, there are some hormones are there. Some of them, lots of hormones are there. I am not going details at all. Whichever is important for your fiber, I will only tell that. One is adiponectin. One is leptin. One is resistin. এইবারেতে এই যে হরমোন বলছি adipokines itself is a type of cytokines, right? It is rather you can say that it is a type of cytokines. So interleukin 6 and also TNF-alpha, right? So these things are normally is released. Normally আমার বেরোচ্ছে তোরও বেরোচ্ছে, but when adipose tissue number is high, then these hormones will be high? No, these things will be high and these things will be low. যখন adipose tissue বেড়ে যায় তখন adiponectinটা কমে যাবে। তাহলে এখানে কে ভালো বলে মনে হচ্ছে? Adiponectin is very good hormone, right? Not only that, leptin also good hormone. I am coming. Adiponectin specially adiponectin is very good for us. Why? Because it can burn the fat, It can cause the you can say glycolysis. You can say your fat tissue deposition will be low. Your fat deposition will be away from the visceral fat. Lots of actions are there for adrenaline, which reduces the chance of obesity. Right? এই ছেলেটি যে এখন ওবেস হয়নি বা ওই মেয়েটি যে এখন ওবেস হয়নি তার কারণ মেবি ডিউ টু দ্য অ্যাডিপোনেক্টিন, right? So if adiponectin means what? Adiponectin means is helpful or against the obesity. Simple. What do you mean by leptin? Leptin has a huge role. Now leptin already I told you in the GI system, right? আমি একটা টার্ম বলেছিলাম leptin and ghrelin. Leptin as source, most important source is adipose tissue. Less source কি সব জায়গা থেকে হয়, অনেক জায়গা থেকে হয়। তার মধ্যে একটা one of the is a placenta during the pregnancy period, and the others are stomach also, brain also. So these leptins are releases different sites having some receptors are there. Now insulin যেমন আমরা ইনসুলিন রেজিস্ট্যান্স নিয়ে আমরা যেমন বলেছি কথা, তেমনি লেপটিন রেজিস্ট্যান্স নিয়ে কিন্তু আলোচনা স্টার্ট হয়ে গেছে, রাইট? সো দ্যাটস ভেরি ইম্পর্টেন্ট পয়েন্ট। ইনসুলিন রেজিস্ট্যান্স গেল তো লেপটিন রেজিস্ট্যান্স চলে এলো। ইনসুলিন রেজিস্ট্যান্স যাচ্ছে মানে আলোচনার মধ্যে দিয়ে যাচ্ছে, লেপটিন রেজিস্ট্যান্স স্টার্ট হচ্ছে। দ্যাট ইজ ইউর ফেজ, right? So what is the role of your leptin to control our obesity? Obesity কে basically control করে, but ultimately পারে না। তাও আমি আসছি কেন পারে না, কারণ লেপটিনের কাজ হচ্ছে লেপটিন acts as a brain। কোথায় করবে? আমাদের খিদে সেন্টার কোথায়? হাইপোথ্যালামাস, রাইট? হাইপোথ্যালামাসে আমাদের হাংরি অ্যান্ড স্যাটিসফ্যাক্টরি সেন্টারস আর দেয়ার। There are different name of the nuclei are there. I am not going details at all. নিউক্লিয়ারের নামগুলো মনে আছে হাইপোথ্যালামাসের কারো? সুপ্রাঅপটিক, আর হ্যাঁ প্যারাভেন্ট্রিকুলার, আর এইগুলো কিন্তু কন্টিনিউয়াসলি মনে রাখতে হবে। হুইচ আর দ্য নিউক্লিয়াই ফর সাঙ্গার এটসেট্রা। আই এম নট গোয়িং ডিটেলস বিকজ দ্যাট উইল go into the different track. So leptin acts, releases from the adipose tissue, from all adipose tissue you have. Then it acts in the brain. How? To decrease your hunger. By তুমি কম খাও। কারণ কি ওবেসিটিটা কি বলেছি? ওবেসিটি ইজ অলরেডি টোল্ড দ্য ক্যালোরি ইনটেক। খাওয়া থেকেই ক্যালোরি আসবে, খাওয়া থেকে তো ক্যালোরি আসবে না। সো ক্যালোরি ইনটেক যদি আমি কমিয়ে দিতে পারি, তাহলে আমার খিদে যদি কমে যায়, হাংরি যদি কমিয়ে দিই, তাহলে আমার ওবেসিটি কমে যাবে বা কমতে হেল্প করবে বা হতে দেবে না। It will prevent that in this way. So leptin acts in two ways. Number one, it inhibits the agouti related peptides. Leptin AG নামটা শোনা আছে এটা? নিউরনস। এই নিউরনকে ইনহিবিট করে। এটার নাম কি বললাম? আগউটি রিলেটেড পেপটাইড নিউরন। ভুলে গেলে এজি আরপি লিখে দিবি, হয়ে যাবে, বোঝা গেল? এগেন it increase the pro-opiomelanocortin neurons. বোঝা গেল? এই দুটো কথা মনে রাখতে হবে। I am not going detail into pathway গেলে তোরা সব বোর হয়ে যাবে। তাহলে কি করছে? লেপটিন আমার দুটো কাজ করছে। একটা হচ্ছে আগারটি রিসেপ্টর পেপটাইড নিউরনস, সব করছে কিন্তু হাইপোথ্যালামাসের নিউক্লিয়াস, দ্যাট ইজ ডিক্রিজড, অ্যান্ড প্রো-অপিওমেলানোকর্টিন নিউরনসকে অ্যাক্টিভেট করে দিচ্ছে। দুটো দু রকম। কি রকম? এই যে এটাকে ইনহিবিট করেছে, এ হচ্ছে আমাদের খিদেকে বাড়ায়, রাইট? আর এটাকে স্টিমুলেট করছে, এ হচ্ছে স্যাটাইটিকে বাড়ায়। স্যাটাইটি মানে কি? ফিলিং অফ ফুলনেস, আমার খিদে হয়ে গেছে, সেটা কিন্তু করছে। এই তো একটু ব্রেকফাস্ট খেয়ে এসছিস, খানিকটা খাওয়ার পর বুঝেছিস যে হ্যাঁ এখন ঠিক আছে, এখনকার মতো, সেটা কে করছে? হুইচ নিউরন? ইন হুইচ? pre-opiomelanocortin. I am not going details how it is chemically done. That is your job in biochemistry, or if you are most sincere student to understand this, you can understand this neuron is helpful, how its satiety is maintained. So leptin is ultimately is going on. So leptin is a very good hormone. Yes, it's very good hormone. But when fat tissue is increasing and increasing, then leptin is increasing and increasing. Similarly for the beta cell, remember that. When glucose is there and there, then beta cell is releasing the insulin and insulin. Then insulin receptors going into the resistant. Similarly, the leptin receptors, leptin is hyperleptinemia. আগে কি বলছিলাম? Hyperinsulinemia, then insulin resistance. Similarly, hyperleptinemia and leptin resistance. Yes. So leptin resistance nowadays, very much understanding, you have to understand what is happening as a leptin resistance. বুঝতে পারছিস? leptin resistance হয়ে আছে. That's why if leptin is resistant, do you think that agouti receptor neurons will be inhibited or POPO melanocortin neurons will be stimulated? No. So that will feel what? Fullness of will be not there. Overeating will be there. এখন দেখবি অনেক মেয়েরা, বিশেষ করে আমি এটা দেখেছি যে মেয়েরা প্রচুর ওভারইটিং করে, খেতে যাচ্ছে পেট ভরছেই না। মেনলি কিন্তু গার্লস, আই ডোন্ট নো দ্যাট জেনেটিক ইজ দেয়ার এন্ড নট, মেবি দেয়ার, maybe the genetic structure or genetic imprinting is there to take overeating. Not all, but in case of male is very less. এমন নয় যে হয় না, অবশ্যই হয়. So therefore it is definitely leptin is, if it is hyper resistance to leptin, then fullness will not come. Fullness আসবে না. তুই বিরিয়ানি এক প্লেট খেয়েছিস, মনে হচ্ছে আরো হাফ খাই, হাফ খেয়েছিস তার মনে হয় না একটু ফিরনি খাই, ফিরনি খেয়ে ফিরতে মনে হলো না আমি একটু, মনে হচ্ছে একটু ওখানে কাবাব দেখতে পাচ্ছি, কাবাব দু পিস খাই। এই যে 2 পিস খাই, 6 পিসের জায়গায় 2 পিস খাই, দ্যাট ইজ হ্যাপেনিং ফর ইয়োর দুটো জিনিস হচ্ছে, একটা ইনসুলিন রেজিস্ট্যান্স হচ্ছে, হাইপারগ্লাইসেমিয়া হচ্ছে, সঙ্গে আমার লেপটিন রেজিস্ট্যান্স হচ্ছে। সো হোয়াট ইজ হ্যাপেনিং ইজ ভিসিয়াস সাইকেল। সো টু রেস্ট্রিক্ট দ্যাট, রেস্ট্রিক্ট মিনস হোয়াট? Restrict means lifestyle and your physical activity, so that the calorie intake cannot be more than calorie expenditure. তাহলে এক্সপেন্ডিচার বাড়াতে হবে, রাইট? তাহলে কিছু কিছু কন্ডিশন আছে যে কন্ডিশনগুলো একে হ্যাম্পার করতে পারে, যেমন এনার্জি এক্সপেন্ডিচার। কিছু কিছু হরমোন আছে যেগুলো এনার্জি এক্সপেন্ডিচার কম হবে। কিরকম সেগুলো? কোন কোন ডিজিজ শুনি একবার। তাহলে কে কে আমার বিএমআর কন্ট্রোল করে? বেসাল মেটাবলিক রেট, থাইরয়েড। সো hypothyroidism, that's why obesity. Number 1. Number 2, Cushing disease or Cushing syndrome, right? You are giving the exogenous glucocorticoids, steroids. Steroids কি করে? স্টেরয়েডের দুটো রোল, একটা কর্টিকোস্টেরয়েডের রোল বলেছিলাম, because stress causing the release of cortisol, and cortisol increases the glucose level high. So if it is increased high, then insulin will come, and that causes insulin resistance. So this is related. So these things are related here. So now it concern is that all are related. All are, you are relating this, right? So adipokines are releasing. Adipokines is different adipokines are there, but our notorious adipokines are these two, interleukin 6 and TNF-alpha. That is our bad cytokines. So that this causing the continuous low-grade chronic inflammation. You already know that chronic inflammation, any disease inflammation will be there, and inflammation is a marker for obesity as well as insulin resistance. So these cytokines are released from adipocyte cells. If number of adipocytes is more, then more adipokines will be more, adiponectin will be less, because this is the only hormone is only helps us. Leptin helps us, but if it is much more releasing, then it causing the leptin resistance. So leptin resistance is there. So the agouti receptor related peptides neurons, AGRP and POMC neurons will not act, will not stimulate it, will not inhibit it. So that will cause the lack of fullness of abdomen or stomach. Rather, you can say stomach. So that you can eat more and more, and then more and more eat meant vicious cycle, fat deposition, more leptin, more cytokines like interleukin 6 and TNF-alpha, right? So these things are very much important. A interleukin 6 যেমন বললাম, there is an important interleukin 2 is there. What is the importance of interleukin 2? এটা আমাদের প্রায় দিনই বেরোয়। কখন বেরোয়? During fever. 1 and 2, mainly 1 and also 2, right? That is called কি? Fever এর একটা নাম কি? Pyrexia. These are called pyrexin. These are called interleukin 1 and 2 is called pyrexin. That is cytokines causing the pyrexia, right? So these things are adiponectin helpful. তো ইফ ইট ইজ শর্ট নোট অ্যাজ এ অ্যাডিপোকাইন্স, আমি আজকে যা যা বললাম যদি এটা লিখে দিস 3-4 নাম্বার তো আরামসে পেয়ে, রাইট? নাও তাহলে অ্যাডিপোকাইন্স আমার বেরোতে থাকলো অনেক অনেক বেশি। নাও অ্যাডিপোকাইন্স যত যা যা বেরোচ্ছে, এর আবার কিছু কিছু ডিফারেন্ট অর্গানে কাজ করবে, রাইট? ডিফারেন্ট অর্গানে কাজ করবে। প্রথম যে কাজটা করবে যে ডিফারেন্ট সেলে গিয়ে কাজ করবে। You know already the cell, there is a receptor, the insulin receptors are there, and also there are some transporter is there, right? Now this is insulin, right? Now এই adipokines কি করে, it causing the negatively affect the insulin resistance and cause the insulin resistance. তাহলে adipokines এর রোল আবার ইনসুলিন রেজিস্ট্যান্স করা। তাহলে ইনসুলিন আর কাজ করতে পারবে? নো। তা যদি কাজ করতে না পারে তাহলে কি এই দিক দিয়ে কি গ্লুকোজ ঢুকবে? নো। তাহলে গ্লুকোজ এখানে নেই, তাহলে এখানে কি হবে? বাড়বে, ব্লাডে বাড়বে গ্লুকোজ। তাহলে গ্লুকোজ বাড়লো, তাকে আমরা কি বলি? হাইপার গ্লাইসিমিয়া। তাহলে গ্লুকোজ বাড়লো, রাইট? এবার চলে আসি অ্যাডিপোকাইন্সের দুটো জায়গাতে কাজ করে, একটা হচ্ছে কিডনি, একটা হচ্ছে অ্যাড্রিনাল গ্ল্যান্ড, কিডনির মধ্যে অ্যাড্রিনাল গ্ল্যান্ড, আর হচ্ছে সিম্প্যাথেটিক চেইনস অর সিম্প্যাথেটিক নার্ভাস সিস্টেম। তাহলে সিম্প্যাথেটিক নার্ভাস সিস্টেম অ্যান্ড অলসো RAAS, হোয়াট ডাজ দিস মিন? Renin-Angiotensin System, ওকে স্টিমুলেট করছে। অ্যাডিপোকাইন্স কি করছে? না স্টিমুলেট করছে। তাহলে র্যাসকে যদি স্টিমুলেট করে তাহলে কি আলটিমেটলি হবে? কি হবে আলটিমেটলি? কি হবে? অ্যালডোস্টেরন রিলিজ হবে। Adipokines increases the aldosterone directly as well as it increases the activity of the RAS, and so that ultimate effect কি না? হাইপারটেনশন, মানে বিপি হাই হলো। সিম্প্যাথেটিক স্টিমুলেশনে কি হবে? বিপি হাই হবে না লো হবে? হাই হবে। Then again it is also increasing the BP. Sympathetic system, হার্ট রেট কি হবে? বাড়বে না কমবে? বাড়বে। তাহলে হার্ট রেট এটা ইনক্রিজ করলো। তাহলে ইন এ ওবেস পেশেন্ট or obesity, hyperglycemia and also this is hypertension, right? And tachycardia হচ্ছে তো? সুন্দর হচ্ছে। নাও আরেকটা অর্গানে চলে আসো। আরেকটা অর্গান কোথায় আসবো? কোথায় আসি? লিভারে চলে আসি। তাহলে যে আমার লিভার সেল আছে সেখানে আমার যে ট্রান্সপোর্টার আছে সেখানে কিন্তু ইনসুলিন ইন্ডিপেন্ডেন্ট, রাইট? ইনসুলিন ইন্ডিপেন্ডেন্ট। আর এখানে আমার ইনসুলিন রিসেপ্টরও আছে, ইনসুলিন এখানে এসে কাজ করতে পারে, কোনো অসুবিধা নেই। কিন্তু না, যখন আমার অ্যাডিপোকাইন্স আছে সে এগেইন ইনসুলিন রিসেপ্টরকে আবার ইনসুলিন রেজিস্টার করে দিচ্ছে, রাইট? তাহলে ইনসুলিন, গ্লুকোজ তো ঢুকে যাচ্ছে, গ্লুকোজ কিন্তু ঢুকছে এখানে, বাট গ্লুকোজটা কি ঢুকছে? ওই 3 নম্বর কাপটা আসছে, মনে আছে? 3 নম্বর কাপটা অ্যাসিটাইল তৈরি করছে, অ্যাসিটাইল করে তৈরি করছে। এই অ্যাসিটাইলের ফেট হচ্ছে অনেক রকম। একটা হচ্ছে এই ফ্যাটি অ্যাসিড তৈরি করতে পারে, আর একটা তোরা বায়োকেমিস্ট্রি নিশ্চয়ই পড়েছিস, কিটো অ্যাসিডস, কিটোন বডিস আর ফর্ম। I will come if time permits. So ultimately it will form inside this, that is কি না? VLDL, আগেই বলেছিলাম, তাই তো? VLDL। যখন এটা VLDL হবে তখন বাইরে কি ঢালবে? ট্রাইগ্লিসারাইড ইনক্রিজ হবে। সঙ্গে অ্যাডিপোকাইন্স is causing the breakdown of the HDL, so HDL level কমলো, কোনো অসুবিধা নেই। আর কি হবে? এখানে সুগার বেড়ে গেছে, আর ব্লাডেতে আমার কি আছে? LDL আছে, ব্লাডেতে LDL আছে। LDL will be glycosylated, কি হবে? গ্লাইকোসাইলেশন বা গ্লাইকোক্যালেটেড, মানে গ্লুকোজ এখানে এসে লাগছে, যেমন গ্লাইকোসাইলেশন বলি সেরকম, রাইট? তাহলে LDL গ্লাইকোসাইলেটেড, HDL কম, ট্রাইগ্লিসারাইড হাই, এটা খুব একটা ভালো জিনিস। কি জিনিসটা তৈরি হতে যাচ্ছে? এবার কাম টু দ্য ব্লাড ভেসেল। এখানে তাহলে ব্লাড ভেসেল এলো, তাহলে এখানে আমার কি হবে তৈরি? অ্যাথেরোস্ক্লেরোটিক প্লাকস, বোঝা গেল? তাহলে অ্যাথেরোস্ক্লেরোটিক প্লাক তৈরি হতে গেলে ট্রাইগ্লিসারাইডকে বাড়তে হয়, HDL-কে কমতে হয়, আর LDL-কে গ্লাইকোসাইলেশন লাগে। 3 ইম্পর্টেন্ট পার্টস, যা বই পড়েছিস পর। These 3 things are the important part to cause the atherosclerosis. এই যে এত ব্রেনের স্ট্রোক, করোনারি অ্যাকুট এমআই, এই সব এইগুলো কালপিট। একদিনে কিন্তু হচ্ছে না, বুঝতে পারছিস কিভাবে হচ্ছে? So this is happening here. So it is atherosclerotic plaque is there. So ultimately কি will form না atherosclerotic, you can say that stroke or ischemia, atherosclerotic part or deep vein thrombosis, atherosclerotic deep vessels thrombosis, right? This is happening because it will be caused, the blood will go and it will clot or it can flow less. So ব্রেনে যদি যায়, ব্রেনে আমার ইস্চিমিয়া হতে পারে বা ইনফাকশন হতে পারে। তার মানে যদি পারফিউশন কম হয় তাহলে একরকম, আর পুরোটাই বন্ধ হয়ে গেল তাহলে একরকম। পুরোটা বন্ধ হয়ে গেল তাকে বলে ইনফাকশন। সেরকম হার্টেও হচ্ছে। সিমিলারলি ইট ক্যান কজ ইন দ্য হার্ট অলসো। হার্টে তাহলে কি হবে, যদি হার্ট রাখি তাহলে এখানে যদি মায়োকার্ডিয়াম, তাহলে দেখা গেল এইখানটা আমার ইস্চেমি হয়ে গেল। প্রথমে ইস্চিমিয়া ছিল, এবার ইনফাকশন হয়ে গেল, মায়োকার্ডিয়াল ইনফাকশন। সো হোয়াট ইজ হ্যাপেনিং হিয়ার? সিভিএ। তাহলে এখানে কি কি হচ্ছে ওবেসিটির জন্য? সিভিএ, রাইট? সিভিএ, myocardial infarction, everything is happening here. Not only that, এই যে পায়ে claudication of pain, এত মোটা দেখবি তারা পায়েতে খুব পেন বলে, that may be due to joint pain as well as vascular disease. Vascular কি হবে না, এই যেমন plaque formation is happening in the lower veins also, and that can cause claudication or chronic ischemia, or it is called chronic limb ischemia, that is CLI. That is called CLI, chronic limb ischemia, also a part of the obesity. Now you find the metabolic syndrome points. এখান থেকে আসছে কি কি আসছে দেখ। ফার্স্ট অফ অল adipokines বেশি, adipocytes বেশি means waist circumference will be more, right? That is for male it is 40 inch and mean female is a 35 inches. Then hyperglycemia part, hypertension was part, আর কি ছিল? triglyceride is a part, আর কি ছিল? HDL, এই যে HDL. So what is happening here? Obesity is landed into the metabolic syndrome. বোঝা গেল? So if in your paper, in any questions, obesity related যদি কোনো questions আছে, consequences of obesity, it may come. Already discussed. এটা লিখলেই 3 পাতা। বোঝা যাচ্ছে? সো এইটুকু লিখতে হবে। তোর বইতে কি লেখা আছে I don't know at all, but these are the current based, evidence based and also good journal based I have explained in short, very very short. So what are the points are here? Adipocytes, white fat cells basically, not brown. White adipocytes number of cells will increase, and that will cause the increase of adipokines. Within these adipokines, there are so many adipokines are there, you already explained. Leptin, one of the important. Leptin was doing in the brain, that is the hypothalamus, right? In specific nucleus, and then it causing the inhibition of the agouti related peptides and stimulating the pre-opiomelanocortin neurons, right? So that our hunger center can be suppressed. So feeling of fullness in abdomen, or you can say stomach, we will feel that, so that we can't take the overeating, so that the reduction of this adipose tissue. But if it is leptin is increasing and increasing, and number of receptors are engaged day by day, then it will cause the leptin resistance after the hyperleptinemia, just like hyperinsulinemia causing the insulin resistance. Similarly, hyperleptinemia causing the leptin resistance. There is now the burning problem of this obesity, and its pandemic is going on. That is obesity. If you understand the obesity itself and the pathophysiology like that, then you can treat not only the obesity, but obesity related your metabolic syndromes are there, right? So what is happening here? The adipokines, any cells that can, this is the GLUT4 hote pare, eta hote pare, there is liver or muscle cells hote pare, that is not going down, going into, that is cause the hyperglycemia. Then it increases the rash or increases the systemic sympathetic nervous system. Not only that, arthaji is adipokine. Adipokines basically inhibits the release of NO or inhibits the NO synthase. So that's why NO will be less. So what will happen? Vasodilatation? No. That is called increasing the endothelin 1. Endothelin 1 is the vasoconstrictor. So vasoconstriction will be there. So ultimate aim ta ki hocche? Blood pressure. So blood pressure will be high. So if any questions come like that, how the obesity or how the accumulation of fat increases our BP, these are the 4 points are there. The rest systemic and also your blood vessels, right? So this is your part, and also it affects the heart, and that's causing the heart rate also. So in obese patient, its basal tachycardia will be there, more than 100 will be there, maybe there, not always. Now this important part. It comes to the liver, storing of VLDL and releasing the triglyceride in the blood, so increasing the triglyceride and decreasing the HDL, and LDL it is glycosylated, but glycosylated you can say, what is the pronunciation? LDLG, and that causing the atherosclerotic plaque formation in all over the body of microcirculations like coronary circulation, like brain, cerebral circulation, cerebral microcirculation. Atherosclerotic plaque is happening here. So that's why this is causing the CVA. That is means what? CVA means cerebrovascular accident, stroke. So stroke also important for your obesity. Todi question dai todi bhabe je write the pathophysiology of the happening the stroke after the obesity. The reason is there, right? So in this fashion, it will affect the your microcirculation of the heart or coronary vessels, that causing the MI, or you can say myocardial ischemia. Then it is a lower limb that causing the chronic limb ischemia or claudication. Claudication kake bola hoy? Painful claudications, right? Limping. Karon ki na, that vessels also giving the circulations less in the lower vessels, so that causing the pain, ischemia, and that causing the chronic limb ischemia, that is CLI in the lower limb. It is the limb, L for not lung, that is called limb. This is happening here. That is your pathophysiology of the obesity, and itself. And adiponectin, only the one hormone that prevents all these things. But when fatty tissue is increasing and increasing, interleukin 6 and TNF-alpha is increasing, so adiponectin will be decreasing. So that is our unfortunate. If it is increasing, then there is no happening here. That would not be happening here. So these things are important. Now, one important to detect clinically by seeing on the lipid profile whether you have or you have any relatives insulin resistance, yes or no. Only these two levels. That is one. The criteria is that there's triglyceride, total triglyceride, and HDL ratio. If it is less than 1.5, we are not in the state of insulin resistance. But if it is more than 1.5, so we are in insulin resistance, right? Boja gelo? So in two detection, only seeing the lipid profile levels, you know the lipid profile examination is done in the biochemistry. So if you triglyceride level and LDL level ratio you can do, then if it is less than 1.5, so your relatives, your father, your mother is not at all in the stage of insulin resistance. But if it is more than 1.5, then definitely he or she is in insulin resistance, or insulin resistance have been already started. You have to reverse it, or in the pre-diabetic state, right? It is written in very good journal, and also in some new research papers, which I also a member of that, and so that this criteria is detected by scientists in Ben Leak of the USA. So to detect this, but unfortunately, we are not following this in India, right? Why, I don't know this case. And also in India, in many of us, we overlook the insulin resistance. I don't know the why, but you are being a first year MBBS student, keep in mind, this is my last class of the insulin resistance. Take home message is that never ever ignore the hyperglycemia, hyperinsulinemia, and also insulin resistance. Because all these things are nowadays is going into a stroke, cancer, CV, etc., happening here, right? So this is insulin resistance. You have to restrict that, and you can restrict in the pathway because it happens for 10 to 20 years, not like the 2 to 5 days. No, not like that. It happens because the preclinical symptoms may come as the insulin resistance. Already told you, some acanthosis nigricans, and skin tag, obesity, fatigue, etc., These are the insulin resistance feature, right? So if any obese patients or obese relatives are within this, and this waist circumference is more than, in case of men, 40 inches, and also HDL, LDL, that means your HDL is low, triglyceride high, that means 3 criteria of the metabolic syndrome is matched, then you at least in this phase you can advise that you have to be very, very careful about your lifestyle, as well as some investigations are important So to do the C-peptide level, to know the insulin level first. If you don't understand the C-peptide, amylin also very important. I just this amylin, you know the its roles, you know already that. But amylin is formed, if it is increasing, then amyloid deposition happens, right? Not only that, in the Alzheimer's disease, you know that many of our grandfather or by relatives is suffering from some case of anxiety disorder or Alzheimer's disease that is related to insulin resistance. Because শুনলে অবাক হবি তোরা, each and every cell has insulin receptor. This is the only hormone which have a receptor each and every cell. Each and every cell means each and every cell. Brain cell to the lymphatic cell, brain cell to the lung cell, liver cell, pancreatic cell, skin cell, everything. Eye cells. You can say that every cells have insulin receptor, RBC itself. Insulin receptor. So insulin receptors is there means chance of insulin resistance. But insulin resistance does not happen in all cells at a time, right? So if it is happen, so now the question is that to you, that what do you mean these classes, that which cell or which organ happens the first insulin resistance? There is some topics and some papers are there, lots of papers basically, not some papers, that our first insulin resistance happen in the fat cells. And you can understand that if fat cells are insulin resistant, then everything is possible towards our metabolic syndrome, right? So these things are very much carefully, it's explained in very lucid way. যা যা পড়ানো হলো এইগুলোর প্রত্যেকটা প্যানক্রিয়াটিক এগুলো থেকে যা আসবে কোশ্চেন, তোরা কিন্তু যারা পড়ছিস বা শুনছিস তারা লিখতে পারবি। আদারওয়াইজ কোশ্চেন কিন্তু ফ্ল্যাট কোশ্চেন এখন আসে না, রাইট? ফ্ল্যাট কোশ্চেন দিয়ে দিল না, এটা তো বইতে নেই বাট লেকচারে আছে, right? So this thing you have to write that. So think about this. What is happening here? What is happening in the liver? What is happening in the skeletal muscle? Already I explained everything nicely. And write down. ভেবে লেখ যে এটা থেকে এটা হয়। ইনসুলিন আগে ফাংশন লেখ, তারপর ইনসুলিনের সিগন্যাল পাথওয়ে লেখ। দ্যাট ইজ ইম্পর্টেন্ট ফর বায়োকেমিস্ট্রি অলসো। তোদেরকে বায়োকেমিস্ট্রি পড়ানো হয়েছে ইনসুলিন? পড়ানো হয়েছে ইনসুলিন? বলে আমি ক্লাসই করি না। পড়ানো হয়েছে? না। So whenever they will touch the insulin, you will see if that you know already much more better way, right? So this is your collaboration class will be there. So this is your insulin resistance, and remember that insulin resistance is your topic, and leptin resistance is now these upcoming topics. So that obesity is now with a pandemic, and it is happening in every family. It's happening there, and obesity is related. So many organs, already I explained how it is related to that. That forms the adipokines and etc. etc. So this is very important. Leptin may come as a short note. Ghrelin is a GI hormone, but leptin can be enter into your syllabus. That leptin, only leptin you can say. But leptin নিয়ে তোকে আজকে যা যা বলেছি তাহলে তো 5 নম্বর হয়ে যাবে hopefully. Now one important, that insulin resistance, that's your homework. Insulin resistance can be divided into pathological and physiological, right? Pathological and physiological. In case of physiological insulin resistance, there is one important hormone, you already know that is growth hormone. Have you heard the term the growth hormone? It's a growth hormone released from pituitary. Yeah, anterior, very good. So what do you mean that growth hormone helps us for growth? Already you say yes, growth. No, not like that. Growth hormone directly does not cause the growth. It happens in downgraded. That is called insulin like growth factor 1, 2, 3. These are our growth factors. These are your growth pathway, not the growth hormone itself. But remember that growth hormone itself causing the insulin resistance. So that's it is called the physiological insulin resistance. Not only that, two other physiological resistance happens in puberty and also pregnancy. Because in the pregnancy, there is a lots of leptins are released as well as the growth hormone. That means it is called human placental growth hormone is released, right? So these are two things that causing the insulin resistance, because Already you know that insulin is resistantly, if it is resistant, then it will not act as a receptor level for the receptor endocytosis. Already explained that.